Hello, my name is McKenzie Montrose, and today I'm going to be talking about my time at a long-term care facility. So question one is to briefly describe my experience encountered during my time at a long-term care facility. What part of the long-term care facility did I observe, participate in, describe any changes or values or feelings as a result of this experience, and how to experience will impact my practice. During my time at the long-term care facility, I was with a CNA and I was also with the RN. I would go with anyone, everyone. I always try to do whatever was needed or provide a helping hand for them because it was very high-paced there. So I know if I could do something to help them and ease the pain, that was going to be okay with me. I did a lot of direct patient care. I was helping the patients with regular ADLs. I helped with changing soiled bed linens. I helped change regular linens. I assisted and watched the nurse administer medications. I also watched proper wound technique and care, and I helped with some patient mobility. Overall, this was a fun experience getting to meet all these different people and learning all about their lives. Describe how it felt to care for a patient residing in a long-term care facility compared to a patient in the hospital. So both of these, compared to the hospital, a long-term care facility is very different. While in a hospital, you're trying to nurse these patients back to health. They have a disease. Once they get over it, they're free to go. While in a long-term care facility, they can't leave. They are there for long-term. And while you're also trying to get them better from what they have, you're also trying to keep them content, make sure they can live properly, keep them content and happy, and make sure their everyday needs are met. In a hospital, once you get better, you can leave. And that's about it. This really opens your eyes to there's not just hospital type nursing, there's also everyday type nursing, which what these people basically receive. How did you apply the clinical judgment measurement model to recognize cues in patients with physical and emotional needs, and what did you notice initially about your patient? So I used the smile to try and recognize the physical and emotional cues that these patients would have. One of the things I used it for was when I was helping bathe the patient and change her linens. I know she would be in pain when you touched her in a certain area, so I tried to apply that and be like, hey, don't put as much pressure on this area when you're helping clean. Do light and be okay, and she was okay after that and everything went smoothly. How did you apply the nursing process to establish goals for a patient, family, and/or staff? What nursing response and/or interventions did you implement, and how did the patient, family, and/or staff respond? I would listen to what my nurse decided her goals for the day were. I tried to help her implement them with each of the patients. One of the patients would resist mobility when he needed to get up and keep moving so his joints wouldn't be hurting him or any swelling would occur. So we encouraged him to get up and to move around, and he did, which was good. We also assisted another patient into getting in a shower after he refused many times. It was a good experience knowing that I could help them for the short time I was there, and knowing that even though it seemed like a small thing to me, it was probably the biggest thing in the world for them, and to helping them move, because these people are used to their independence. As humans, we love independence. We love doing things for our own. While they're here, they need the help, and they need any type of help they can get. So it's nice knowing that I can help them in this little way. How did you embrace cultural diversity among special populations within the long-term care facility? I tried to be careful with how I worded things. I know I'm from a younger generation. I know I talk differently than people in an older generation would. I know there is that type of language barrier there between us, so I tried to make sure everything I said was clear and concise, making sure they could see my lips and what I was saying directly to them, and just trying to eliminate any barrier that could possibly keep us from helping them with their care. Describe any emotion stressors related to your long-term care clinical experience. Were there any issues involved with the patient and/or patient's family? And did you encounter any communication issues or ethical issues? I do not I don't think we encountered any cultural or ethical issues. The only type of communication issue I would notice is some of these patients are nonverbal, so they're not going to tell you exactly what is going on or what is bothering them, but they do have physical cues. They got these facial cues that happen. If I touch them here, they're going to make a wince of pain and they're going to look like they're in pain. So I just tried to pay attention to what this patient looks like when I'm doing something, or if they're jerking their body in a certain way. So we can't physically talk to each other, but I can observe you and see what's going on. I was a little stressed when we first came there because these are older people. They are living there long term, and I think there's just the fear of you doing something and accidentally hurting these residents when in reality they're excited to have you there. They're happy to see new people. They're always laughing with you. And after I would talk to these people and get to know them a little better, the anxiety went away, and they're just regular people excited to meet younger people and to talk with them and tell you all different stories that they have going on. How did you collaborate with the interdisciplinary team? So I was there, I was moved around a bunch of times, talking to everyone, seeing everyone. I was with my RN, and then I went with the CNA. So I just tried to make sure there was communication between those two. If I would go do some basic things with the CNA, I'd come back to the nurse and be like, hey, we just cleaned this patient's room and their linens, we just helped change them, or vice versa from the RN to the nurse, or even with the patient and letting them know what's going on, what we're doing next, and just making sure there's always this open communication between everyone. How did you promote effective communication during your rotation? Like I said earlier, I tried to keep an open channel for all of them. And if I was talking to CNA and be like, hey, the nurse needs you to go do something, or from the CNA to nurse, hey, me and the CNA just did something. We want to know if there's anything else that you want done. Or again, telling the patient what's going on, what we're doing, letting them know if a speech therapist is coming in, or physical therapy, or if anything like that's going on. Describe 3 ways your nursing skills expanded during this clinical experience to include improving documentation of care. One of the things that I would say grew is my understanding of patient advocacy. These patients are here for long term, and these nurses and CNAs or even the LPNs are with them 24 hours a day. They know these people. They know what's normal for them. They know what's not normal for them. And it just helped increase my understanding of being, even if I'm not there all the time, if I'm there half the time, I know what's normal for my patient, and I know, hey, this patient's hemoglobin is elevated, something's going on here, or hey, this patient's blood glucose is low, let's run some tests and check that out. Another thing I noticed, I think grew, is time management. This is a very fast-paced facility. They're always going from one room to the next, to the next, to the next, trying to make sure they get all of these patients everything done in a timely manner. So just knowing if I can keep everything in order and do everything perfectly in time, then I can get it documented later, and I won't need to stress about that. Another thing I would say I grew more effective was documentation skills as well. These nurses are since it is very fast-paced, they're doing a lot of things at the same time or at different times, so knowing that they can keep everything documented correctly and everything looking good, knowing that they can do good by this. Explain how your clinical experience at the long-term care facility enhanced your role as a student nurse. I think that this was a good experience to go to a long-term care facility. I think it's a good way to show student nurses there's not just hospital type nursing, there's also long-term care. You can also work at a you can work at a doctor's office, you can work at tons of different places. I do believe that this is established. I do not want to become a long-term care nurse, but it's nice knowing that there are people out there who love their jobs. Every time I talk to a nurse there or a CNA, they're telling me how much they love working in the long-term care facility, and every time I'd ask why, they say they really do it for the patients and for their care. So overall, it was a great experience.